Hi everyone, it's Capriya, and I want to talk a little bit about the intersections between research and data and policy. So as many of you already know, research informs policy, policy informs research. And so it's really important to think about how these two things intersect to really understand how policies become to be or how we end up researching different things. And so I'll start out talking a little bit high level about the different types of research and data, then talk about what it looks like to connect them to policy, and then share some of my own personal experiences of doing this type of work. So at a high level, research includes qualitative and quantitative data. And so quantitative data, typically your numbers, your statistics, survey data, etc. It can give us information about how many were impacted, the total cost of things, how statistically likely something is to happen. That information that, again, can tell us generally about groups or populations or things on a large scale, or just the count of individuals that are, involved in this issue. Our qualitative data provides more context. It's usually your interviews, your focus groups, conversations with individuals that can help us understand more details about the why, how things happen. So where the quantitative data might tell us the number of people who have been participating in the program, the qualitative information might tell us their experiences in that program, or maybe why certain people didn't participate in a program. So in the policy world, it's really helpful to have both types of information to paint the biggest picture of kind of the context and the situation that's going on. And so some of the ways in which this information interacts, or the ways in which research and policy interact, is that you can create research, you can create interviews, surveys, or conduct interviews, create surveys, conduct focus groups, etc., to be able to draw conclusions and make recommendations, policy recommendations. You can also leverage research, so your peer-reviewed articles, your clinical trials, etc., and leverage that information to, again, draw conclusions and develop policy recommendations. And so for specific examples of that, so I'll talk about one project that I've worked on, which is around child welfare prevention. And in that project, we have conducted surveys and focus groups to really understand the experiences of various groups, including those who have been involved in child welfare, as well as those who administer these programs, to understand and learn more about their perspectives of child welfare prevention and perspectives of the child welfare system. And that information that we've created through that research can be used to develop policy recommendations at a large scale. And so again, we're creating research and then using that to help us understand kind of what the field believes should be done as far as how to improve the system. And then on the opposite side, I worked in state Medicaid, and in that work, we have processes and policies around what things are covered under Medicaid. And so as part of that process, you have to review and analyze the literature and the research around a treatment. So if you want a treatment covered under Medicaid, then you need to understand it or determine whether there is substantial evidence that this treatment will benefit those who are looking to utilize it for a specific ailment, illness, or condition. And so as part of that, you have to review the clinical research trials that have been conducted on this treatment or conducted using this treatment and determine whether those trials show that there's substantial evidence that that treatment will positively benefit patients who are using this treatment. And so if that is the case, then you can recommend that this particular treatment or product is covered under Medicaid. And so again, that's the way to leverage research to inform policy decisions. And so again, this is just high level. I welcome other people to share their experiences, their thoughts, perspectives on how those connections between policy and research occur.